would like to thank all the attendees and our guests who are here with us today. And amongst so many renowned faces we have, I would like to recognize few of those who I was able to spot. So we have amongst us Professor Yashwant Pathak, Mr. Ritesh Tandon, who is a candidate for Congress, Dr. Junjunwala, Mr. Yogi Chugh, Mr. Sukhi Chahal, Mr. Arun Kankani, and Mr. Chandru Bhamra. I may have missed, few names, so please pardon me for that. Now, I would like to introduce our esteemed panelists here who are with us today. We are very privileged to have amongst us 11 such wonderful leaders from the community, along with our chief guest, Mr. Taranjit Singh Sandhu and Professor Ved Nanda. Our first panelist, Dr. Bharat Barai, who is a director of Cancer Institute, he had to leave. He was here amongst us, but he had to leave for some medical emergency, and he had, just dropped out from the meeting. Our second panelist is Dr. Suresh Reddy, president of API, Dr. Ramesh Japra, who is a founder and chairman of Americans for Hindus, Kalpesh Joshi, he is director of AAHOA, Mr. Navneet Chugh, he is attorney CPA of MD and also runs and is MD of Chugh firm, Dr. Venk Shukla, ex-president of Thai Global, Dr. Sampath Shivangi, president of Indian American Forum for Political Education, Professor Sri Srinath, president of Seva International, Vishal Khera, he is an entrepreneur, Dr. Mandar Patekar, radiologist and HSS coordinator, and Amrita Haude, she is master's in psychology and public health and also an Hindu Yuva coordinator. Now, I would like to request our first panelist, Dr. Suresh Reddy, to share his thoughts with us. The set of the program would be each panelist would get 4 minutes. There will be a timer running on the screen. I would request all the panelists to present their thoughts, to share their thoughts and insights, 4 minutes each. I would now like to request Dr. Suresh Reddy to start the.
Thank you, Ms. Israni ji. Can you hear me all? Can you all hear me, Israni ji?
Yes.
Thank you. Thank you again, and thank you for this forum for inviting me, and also special thanks to Sandhu ji. He has been extremely, Ambassador Sandhu ji is extremely instrumental in several of the API projects today. API, as you know, is an association of almost 80 to 100,000 Indian physicians, first, second, and third generation Indian physicians representing their interests. We have paid membership of almost 13,000. API, our main goal is education, mentoring, research, service, and charity. Those are our mission goals. And this year we started with our main goals were prevention of childhood obesity. Obesity, as you know, is a worldwide disease. And also training CPR. These projects we have done in all the obesity project and awareness, and that itself is a huge success. Then in the middle of the year or coming to the end, when we are ready to prepare our Chicago convention, we got stumbled on this pandemic. It has hit us so hard, the whole world, and it has given API, the Indian physicians in the United States, a major challenge. And all the Indian physicians in the United States have come up to the challenge, did extremely well, and now we are seeing the other downslope of the curve. We have done several projects in the last 3 months. Especially, I would like to thank again Ambassador Sandhu ji for extensive cooperation from the Ambassador's office. We were able to provide more than 1,000 online prescriptions to all the Indian visitors who are stuck here for their prescription extensions and free medical care. And we opened an online website on our website for helpline, and 60 Indian doctors were constantly working on the website trying to help these Indian visitors who ran out of their prescriptions. And Ambassador's office was extremely helpful. Amit ji and Anurag ji, they were extremely helpful from the consulate office. And coming to the education, we did so much, like public education, health education is for the public, and we released press releases, we did TV ads for health cleanliness, and API is the first organization, health-related organization, that called for a total national world lockdown. We called for the first wearing masks, universal masking. We called for heavy health and hygiene and hand sanitization. So these are all the health related programs we endorsed. Then coming to the physician, like a medical education, we conducted more than 50 webinars in the last 3 months to educate the physicians, because our organization has almost 100 chapters all over the country in every state. So we educated the physicians from all over the world, India, Australia, Europe, because we're all sharing the knowledge. So the more you share, the more you get. So that way we educated all the physicians and updated them about the new treatments, new protocols, and we brought the hospitals in the rural area to come up to the speed with other protocols. We did several research projects. The main one is a plasma research project. We coordinated with the Mayo and several connected them to rural places so that this will go on a seamless, especially the convalescent plasma treatment. We also did several research projects on how Indians, for some unknown reason, with our ethnicity and our genetic makeup, we are a little bit more resistant to these infections than the rest of the America. Especially if you look at Indians, the number of population, the congestion, and it's a 1/3 of size of America, but almost like thrice the amount of population. And still we have more resistance. So we are doing research on that. We did mentoring, especially the younger doctors and also doctors in the rural areas. And we did services. Our own physicians came out of them retirement, and several of them worked at the front lines, and they provided the service. And coming to charity, and we raised huge funds to increase the protective devices like PPE equipment to various doctors in various county and city hospitals which lacked them. And coming to the last point, we honored more than 10,000 nurses in over 100 hospitals in over 37 states, including Hawaii and Alaska. This is a token of appreciation of all the hard work the nurses did in America. Thank you all. Hopefully I did not cross my 4 minutes. I didn't time. Thank you. And if I cross, I apologize. If I didn't cross, maybe I'll donate my time to someone else. Thank you so much.
Thank you so much. Thank you so much, Dr. Suresh Reddy. You didn't cross your time. So thanks for being precise, and thank you for your insight. I would now like to request Dr. Suresh Reddy. I would now like to request Dr. Romesh Japra. Thank you, Suresh ji, again, and I would now like to request Dr. Romesh Japra to share his insight with us. Dr. Japra ji, are you here?
Can you hear me? Am I muted? Okay, thank you.
Yes, we are able to hear you. Thank you.
All right, बहुत धन्यवाद. I tell you, what I have is going to take a lot more than 4 minutes, but I'll try to finish within 4 minutes also. You know what my personal views are. It's amazing what we have learned over these 3 to 4 months last. But I'll, since I'm representing not personally, but the Festival of Globe and the Americans for Hindus, so I'll just cover a few things, how we got affected as communities. As you all know that, before that, we have been celebrating a lot of culture, Indian culture, which we have been very, very proud of. It's in our blood, and we come from back home, and then here, no matter where we are sort of drenched into it. So we started with Festival of India, India Day Parade. For many, many years, we've been doing that. And when I talk about culture, it carries everything. It carries our religion, our spirituality, our languages, our dances, our festivals, and everything else. So we've been celebrating it, but unfortunately, since the holy time, Vaisakhi, the Pongal, and many, many other festivals, we had to cancel them, and literally cancel them, because whatever we do virtually, inside, it's not the same. So I remember good old days, we started doing these festivals all on the outside. Before that, we used to. But once we started doing the parade and we started sharing our culture with everybody else, with all the other communities, and we made it Festival of Globe. So it's not that we want to share with our children or our generation, but also the mainstream Americans. We wanted to share our culture. So we've been doing that basically outside, close the roads, get the parks, get the Alameda County Fairgrounds, Santa Clara Fairgrounds, many, many of these fairgrounds. So we've been doing it all over. And that experience we've been missing. So we've not been able to share it. But sometimes, people think there's some good things happen whenever something like this happens, this pandemic happened. So some of the good stuff also has happened. We have been able to sit back. Of course, I can talk about, I've not been sitting back that much because I'm on the front line. I work every day. The weekend I take the call. So I've not taken a single day off as far as I'm concerned personally. But otherwise, I've been able to talk to a lot of people. We've been able to ponder over, deliberate things, get our mind shares together, been able to think about many, many things, just like FITS, the think tank. I think we've been able to think over exactly what have we been doing, whether this has been the relevant thing. And one big jolt which we had, because our own children, our next generation, who we nurtured them to become, servants of the public servants we call them, or they call themselves politicians. We had the people like Pramila Jayapal or Ro Khannas of the world, and who really shifted to the left, became socialist, and as a matter of fact, got hijacked by some of these terrorist ideologies, no matter what you call them, as you call them, Islamic terror or red terror. Now, there are a lot of those things that those terror groups are out there, and their ideology. I don't mean the Muslims as such. I don't mean Chinese as such, because they are brothers and sisters and we love them. I'm talking about their ideologies. And when our kids got hijacked by them, we started thinking that there's something wrong, which we did over the last 4 to 5 decades. We need to change. So we put together this Americans for Hindus, not Hindus as a religion, but as a dharmic civilization, as a culture, which means righteousness, truthfulness, all the good principles, the guiding principles, which every one of you know. I don't need to go into those, repeat, otherwise it'll take a lot more time. But we've been able to get some of our people who are really dharmic, who was running for these political candidates in the Congress, at the Senate level, and many, many others. We are also aligning with some of our ideologies, which are family values, who align with us. So this problem is not only in America, it's in India as well happening. And as a matter of fact, globally it's happening, and we need to correct it. And that's why we're trying to empower our communities. We're trying to be the political power for them so that we can be, unite ourselves together under a sort of different umbrella with different philosophy, different ideology, and different culture. So the culture is the same, but I'm talking about now the culture as a civilization. So that's what we're trying to do, and hopefully it'll go a long way. Many of you over here, I'm noticing that they are all part of us. Those who are not, they can become part of us. I think this is a movement, this is a revolution which needs to come. We started gather, from here in our Bay Area and in our valley here. I think another revolution is going to take place, which is probably going to go back home in India as well as others. We don't want tukde, but we want Akhand Bharat. And of course, we want this ideology which can lead, and all these other democracies, the modern democracies, not go back to socialism and communism. So I'll stop right there. I don't know if I did that 3 or 4 minutes, but like I said, we've been missing a lot, but we've been gaining a little bit also. And hopefully come elections November, we'll be the winner, and we'll work with them, and we'll try to bring this change, which is very, very much needed, not only in America, but also back home in India and globally. This change is definitely needing. We no need to go backwards towards leftism, communism, socialism, and all those ideologies which have failed again and again. So we need to stick to our guns and try to bring our dharma as a principle to guide everybody. Dhanyavad.
Thank you so much, Dr. Ramesh Chopra. It was very insightful. And you didn't went that much overtime, so it's fine.
Okay, good.
Thanks for your insight again. So I would now like to request Kalpesh Joshi, Mr. Kalpesh Joshi, who is the Director of Asian Hotel Owners Association. He's an active leader in the Indian American community. Dr. Kalpesh Joshi, are you on?
Namaste.
Namaste, Dr. Kalpesh Joshi.
I'm not a doctor. I'm just a business person. I own the hotel.
My bad. Sorry.
Okay.
Apologies.
Asian American Hotel Owners Association, we are the largest hotel owner association in the world. We have 20,000 plus members, and we own every other property in the United States. Our members own every other properties in United States. As you know, that when COVID-19 happened, the travel industry has been hurt the most. Our members own the properties by the airport, by the universities, by the convention centers, you name it. We have hurt so badly, but we are managing to fight in this critical time. Also, as an association, we have a lot of educational programs. We conduct more than 400 webinars, but this year we have also come up with special training for our members, how to be safe and to protect our employee and to protect our guest. So we have the special training for all our members. Besides that, we are continuously fighting for our members with the franchisor to reduce whatever way we can benefit our members. Particularly, our win was we have stopped the breakfast, also all the other food services which we were giving it free to the guest. That has been, it has been suspended for at least 6 months, and we are trying to make sure that we reduce that in the future. So that was the impact, and that is what has been going on the travel industry. Hopefully by 2021, we may see some change, but in near future, we don't see any hope. But despite of all this situation and all this trouble we were going through, our members have come forward during this pandemic when the time was there to help our Indian student. Our members have come forward, and we have committed 5,000 rooms, and then it was growing. But so far, we have helped 3,200 plus students across the country, including our people who they were not student, but they came here for social work or any other reason, and they got stuck here due to all this flight closure and whatnot. So whatever way we could help our community in this critical time, we did that, and we will continue to do that. Besides that, the time is tough for the travel industry, but we will come back, and we'll come back strong. Thank you very much, Ambassador Ji, to give us a time and to listen to us. We always appreciate, this is the second time we've been talking on this Zoom call. Thank you, Khande Rao Ji, and all the other organizers who gave me opportunity to speak on this forum. Thank you.
Thank you so much. Thanks a lot for your insight. Just a quick housekeeping rule. All these panelists would be here, and after their insight, we'll have a Q&A session. So request to all the participants and all the guests and the audiences in the chat room. Please feel free to post your question in the chat room. We will take those questions in the order we receive them. So feel free to ask questions. You can address your question to a specific panelist. If it is a generic question, we will then direct it to the appropriate panelist. So thank you again. And I would now like to request Mr. Navneet Chugh to share his thoughts and insight with us. Mr. Navneet Chugh.
Thank you so much. Good morning, good afternoon, everyone. Hope all of you and your families are doing well as well. I've been asked to speak very briefly about the immigration impact of COVID to the Indian community. I keep it very short and very brief. First of all, green cards and citizens, there is no change. For people that green card petitions are being processed, those people might see a delay because when employers have to advertise that there is no employee available in the United States. So obviously when they advertise now, a lot of people will apply. So those people whose green cards are pending might see some change. For H1s and L1s, it's been really bad. A lot of them have lost their jobs because the employers that they further work at and client sites are shut down. And the worst thing is H1, L1 people are not eligible for unemployment. And those that needed to return back because they don't have work, there's no flights. And so they're running out of status and with no salaries, no money. And our clients and employers have been helping as much as they can. And you cannot even write a salary check to somebody who's not on H1 or L1 visa. So they're triply hurt. Uh, and no travel back to India has been the worst thing for them. But the good news for the rest of us and for the business people of United States and especially the Indian community, the government's done a lot. There have been a lot of unemployment benefits that have been increased. Almost everyone making under 100,000 was sent a check of 1,200 per person. The government's paying for 2 weeks of sick leave and 10 weeks of family leave. And for people running businesses, it's one of the few countries in the planet that has done it and has the resources to do something like this. The government is paying for all employees' payroll for 2 months for 8 weeks, up to 100,000 a year. In addition, the government has is giving out the other loans, PPP and EIDL, are for smaller businesses. If you have a big business, including big hotels, the government's giving Main Street lending programs at 4%, 2%, 5%. PPP has been really beneficial. Some $2 trillion has been spent on all these programs. 90% of my clients have received payroll protection program loans, which is actually a gift if you pay your employees. And finally, when life gives you lemon, then you make lemonade out of it. And we need to stay optimistic. The best thing of our culture is sarbat ka bhala, and we always worry about our community, our family, and our larger community. And we need to see how we can make lemonade out of this lemon. And what is working for people is they're simplifying their lives. They're doing their wills and trusts that they weren't doing. They're exercising. They're eating better. They're shutting down businesses that are not working. They're cleaning up their offices and cleaning up their homes and paying off debts that are just unnecessary, reducing the financial burdens on the families. And above all, I have a sign on my desk that keeps me going. The sign says TTSP, this too shall pass. We shall overcome this. The world has overcome worse disasters than this, from Black Plague in 1300, where half of the world vanished, and 52 million people dying in 1918. In Spanish flu, it should have been called the Indian flu because more people died in India than anywhere else. 12 million of the 50 million people died in India. We have overcome all of this. This too shall pass. Hang in there. Thank you.
Thank you. Thank you so much, Mr. Chak. It was very insightful. Now I would like to request Venkatesh Shukla to share his insight. He is an ex-president of TIE Global. So Venkatesh Shukla, are you here, Mr. Venkatesh Shukla?
I'm here. Thank you. Namaste, everyone. I'm thankful to Khande Rao ji and to FIDS for arranging this conversation. Very timely. I am a seed stage VC, and I invest in B2B companies. It so happens that 8 out of 10 entrepreneurs that I fund tend to be Indians. Among all VC funds that invest in B2B companies, the proportion of Indians in my portfolio is higher. But you'll be surprised to know that it's not that much higher. Mind you, I'm only talking about B2B startups. So more than 50% of B2B startups in the Valley have an Indian as a founder, while our proportion in the population in the Valley is mere 5%. It's a mind-boggling statistic. I did a simple exercise and looked at the recent acquisition history of the most prolific acquirers in the Valley: Cisco, VMware, Splunk, and Palo Alto Networks. Guess what? 60 to 70% of the companies they acquired in recent years had Indian founders. 60 to 70%. So the message really that should go to non-Indians is, hey, if you want to get your company funded and get an exit, you improve your chances if you bring in Indian as a co-founder. So needless to say, that COVID has disproportionately impacted Indians just because they are disproportionately represented in the entrepreneurial community. So mid-March to mid-May were the peak of panic and uncertainty. If a startup happened to be raising money during those 2 months, it had a huge challenge. If it had raised money, and before that, they were okay. 3 of my portfolio companies were caught in that period. They all raised money, but at a significant discount, as much as 50% to the valuation they expected just a few months ago. And I'm sure this story was repeated across all venture funds. One impact practically every company startup felt, was that their revenues came crashing down. The customers were in panic. They're also facing uncertainty. And the first thing that anyone does in that situation is to hold off on new purchases. So majority of the companies essentially had to tone down their revenue expectation very, very significantly. They had to adjust their burn rate, which means how much employees they have on their payroll proportionately. And they had to just adjust to this new reality, very, very quickly. There are some companies that did well, especially those customers that relied on people gathering in one place to do the work, and they couldn't do that anymore. So those companies that solved those problems with technology, they did extremely well. So for example, one of my portfolio companies does automated custom clearance of shipping containers, which is extremely, stuck in, in the process 200 years ago. People sit down and see with 200 pages of tariff table and do all those things. So those kind of companies did very well. I think I'll just keep my remarks to this, and unless there are any questions later on. Thank you.
Thank you so much, Mr. Shukla. I would now like to request Dr. Sampath Shivangi, who is the president of Indian-American Forum for Political Education, to share his insight. Dr. Sampathji, are you here? Dr. Sampath Shivangi? I think you're on mute, for some reason not audible. Can somebody else confirm, is he audible?
No, I cannot hear him.
Can you all hear me?
Yes, yes.
We can hear you, yes. All good, yes, we can hear you.
Yes, yes. Go ahead.
We can hear you. We can hear you, Dr. Sampath Shivangi.
I don't think he can hear us.
I have messaged him. Let's give him a couple of seconds. Otherwise, we'll go back.
Hello?
I just unmuted him.
Yeah,
We have an audio problem. I cannot hear.
We can
we
hear
can
Can you
hear
hear me?
you. Yes. We can hear you.
Yeah, I will call him and tell.
Yes, all right.
I think we have audio problem. You can move to the next guest.
Yes. So while Khanderao-ji is calling Dr. Sampath, and we'll try to fix the audio issue, we'll move on to our next panelist, Professor Sri Srinath. He's a president of Seva International and a professor at Case Western University.
I cannot hear.
So Professor Sri Srinath-ji.
Namaste. Can somebody turn on the slides?
Yes,
Okay.
your slides are here.
Okay, thank you very much. Just wanted to give you a brief presentation on what SEVA International has been up to during COVID pandemic times. First of all, I'd like to thank FITS, Kandarao and also many of my friends that I recognize here and some that are new. Thank you very much for this opportunity and Honorable His Excellency Ambassador Ji. So when COVID hit, SEVA International got into the act actually very, very early. And that was actually a good thing. We recognized that there was something brewing and we decided to take certain actions. And here I would like to present to you the last 3 months of work that we have done. Okay, and first of all, we took a 6-pronged approach. We created non-medical helpline. We have 10 of such helplines, which span not only the breadth of United States, but also we started receiving calls from outside of this territory, from Bharat, from Singapore, from Australia, and even from Congo. So there are some non-medical issues that people would bring up. Sometimes they were afraid that they had COVID and so on. A lot of international students who needed help, and people with certain mental challenges that called because of the pressure that has been brought on with the disease. So the second thing that we did was we recognized that medical supplies, PPEs, were in shortage. So we arranged for all to try to import it from India, and of course India needed whatever that they produced, and we could not get it from them. Then we moved to China. We started importing medical supplies, and of the $1 million that we have raised, more than $1 million that we have raised, about half of it went to buying up medical supplies and distributing it to county hospitals and front responders, the frontline people, and so on. So we also started doing food and groceries distribution. We have so far touched about 198 cities through all these approaches, and we those cases that needed a little bit longer to solve, we move them into case management. We have been working with international students directly. We have helped 300 international students one-on-one, whether it was a shelter issue, whether it was food issue, whether it's a health issue, or travel visa issues. And we have been working with senior citizens, to help them get groceries, medications, and so on as they are stuck at home. Along with them are immunosuppressed people too. Can you move on to the next slide, please? So here are some statistics on, we have over 3,000 volunteers engaged in COVID relief, and we have donated more than $140,000 to food pantries. We have tried to, as this is a very large problem, and so being a small organization, we reached out across the board to many organizations. We have a direct working relationship with more than 500 organizations, even though we reached 1,000 of them. And we have donated about 625,000 KN95 and 95 and surgical masks. We also have about 500 people across the United States involved in making masks at home, stitching them at home, and distributing it to their local hospitals and so on. We have served more than 65,000 hot meals, and we have served 45,000 families. And we have about 500 physicians and attorneys who are working with us, donating their time and giving advice to people or helping locally. Next slide, please. So here is some data on what the kinds of the stuff that we are doing, some more data. And we are conducting webinars of different kinds. More than 100 webinars to date have been conducted. These slides that I have is maybe about 3 weeks old. So next, please. We have 43 chapters through which we have reached. These are some of the PPE information that we have done. Next slide, please. So the various endorsements by many of the prominent people who, and also organizations who are working with us in this work. Next slide, please. And thank you very much for giving you this briefing. And if there are any questions, I'll be available later.
Thank you so much, Mr. Srinath. It was very insightful and it was very good to see the work SEBA International has been doing. So can I now request Mr. Vishal Khera? He's an entrepreneur, founder and president of Creative Systems and Consulting. Mr. Vishal Khera?
Hi, can people hear me?
Yes, we can hear you loud and clear.
Awesome, wonderful. Thank you for the opportunity to speak here. And really, it is extremely hard to follow Professor Srinath ji with all the work that SEBA International is doing. So absolutely, I will try to do a little bit of justice to that. I am Vishal Khera. I'm president of Creative Systems and Consulting. We are a federal consulting organization offering, based out of Northern Virginia, offering IT services to various federal agencies like U.S. Department of Agriculture, Department of Treasury, Small Business Administration, and several other agencies. So, we've had for last 3 years an internal program called Creative Cares, through which we reach out to the community at large. We have done several events as part of the Creative Cares efforts for a wide variety of community initiatives. But as part of COVID-19 support, what we did was we signed the Sankalp Patra that SEBA International had provided early on, which was essentially saying that, yes, we don't know what is expected or what we will be facing over the next 3 to 4 months or longer, but let's all of us Indian American organizations come together and coordinate our efforts. That was the Sankalp Patra that we signed with SEBA International. And that was really helpful because it helped us combine our efforts with several of the local like-minded organizations, whether it was the cultural organizations, temples like Chenmai Mission, Rajdhani Mandir for Youth, Asha Jyoti, or with other corporations in the similar field, like Zolon Tech or Peridot. So all of us came together in Northern Virginia, DC area. And what we recognized was that immediately after the COVID crisis hit, a lot of homeless shelters, their typical donors or the folks who were offering services there, they pulled out. And they were left with nobody providing food and other supplies to these shelters. So as part of the overall SEBA International's efforts, Vimla Ji Rangwani coordinated all of these efforts in the DC area and brought our organizations together. We raised a lot of funds to start helping these local shelters. We helped about 6 to 7 local shelters. At one point, we were the only organization offering them meals, warm meals, well-packed meals for about 15 days. Since then, the other organizations have come back and they are now getting back into their usual way of working, but we have still continued to offer those services. As part of the overall SEBA International efforts, we have provided about 2,000 meals to the local DC homeless shelters. So it has been a great effort, coordinated, very well organized, and demonstrating that Indian American community is really ready to give back within the communities that we are operating in, and it has been very well received. So thank you, Srinath ji, for taking that effort. Thank you, Vimla ji, for all the coordination that you have provided throughout this period for really making the difference.
Indira ji, the chat is disabled.
Okay.
Yeah, just hold on. So, Bhanu Gowda ji, please enable the chat.
Yeah. While we are fixing that, thank you again, Mr. Vishal Khera, for the insight. A quick reminder to all the audiences, once the chat is enabled, please feel free to ask your questions. You can refer to a specific panelist and ask the question. If it is a generic question, we will redirect it as appropriate. Now I would like to go back to Dr. Sampath Shivangi. Dr. Sampath Shivangi ji, are you able to hear us? Dr. Sampath, are you able to hear us? Looks like there are still audio issues. Kandirajji, do you want to coordinate that? And we'll move to our next panelist.
You can move to the next.
Yes. So I have a very difficult task of timekeeping. So that's why I'm sending, or I will be sending the messages in private chat to all the panelists. So apologies for that. This is a very tough task, but we have to keep track of time, and that's why, trying to monitor the time better. Dr. Sampath Shivangi, are you able to hear us before I move on to the next panelist? Looks like not. So let's move to the next panelist, and Kandirajji will be coordinating the audio issues with Sampath Shivangi. So Dr. Mandar Patikar is our next panelist. He is a radiologist by profession and HSS coordinator. Dr. Mandar Patikar, are you on?
Yes. Can you hear me?
Yes, loud and clear.
Okay. So namaste everybody. Thank you for having me. So I'm representing Hindu Swayamsevak Sangh, which is popularly known as the Sangh. So Sangh aims to organize the Hindu community in order to practice, preserve, and promote Hindu values. And part of this training is to conduct seva activities. So we have about 219 shakhas or the branches in 31 states with a weekly attendance of 7,000. I was just trying to start my timer, make sure, okay. With the COVID-19 pandemic, we got quickly in action. We work very closely with Seva International, and many of our volunteers are shared and common. So we have Seva activities in 27 states, 198 cities, and we collaborated with 426 other organizations. We also contributed 2,049 volunteers, and the beneficiary organizations were about 352. Most of the common activity which we conducted was giving fresh meals to hospital staff, EMS, police, and even jail staff workers. We distributed about 4,300 fresh meals. Of course, mask making and distribution along with Seva International, we contributed to that. We also helped stranded tourists and isolated seniors with groceries, filling prescriptions. Many of our volunteers are doctors, and that helped a lot. We also had spiritual help. We had Ram Katha in 7 languages with live reading. We also had online yoga classes. Overall, we touched the lives of about 150,000 people through different activities. And even though we conduct Seva activities routinely, we had to do some innovation. I'll just give you an example. There's a small town called Peoria, Illinois, where they do weekly reading activities for kindergartens and first graders in underserved part of the town, which is mostly 95% African American. Now we can't see the kids. So what to do? So what we are doing now, actually next week, we are distributing gift bags to the houses of 80 kids with have summer activity kits, reading material, and of course some snacks for the kids. Every year at the end of our reading program, we do field trip and celebration. And of course we can't do that because of the current issues. And this is our way of telling our kids that we have not forgotten them and they are just like our own kids. We have some other programs which are currently stopped, but we are working on other ways of doing them. We have a Saturday in-person tutoring for 2 hours. More than 150 students have benefited over the 7 to 8 years we are doing that. Similarly, for the reading program, we have had more than 300 students over the years who have benefited, and more than 40 volunteers who have benefited from these programs. I'm purposefully using the word volunteers are benefiting themselves by conducting the seva. Overall, Sangha is doing its utmost to help with the co-relief effort. and we'll continue to do that.
Thank you, Mr. Mandar. It was insightful. Thanks for sharing the efforts put by HSS. I would now like to request Amruta Haude. She has done Masters in Psychology and Public Health, and she's also an Hindu Yuva coordinator. So Amruta, are you on?
Yes, I am. Namaste. Can you hear me?
For me, your audio is very low. Not sure about others. If possible,
fine.
could you please louder?
Sure, I can. Great. Namaste, everyone, and thanks so much. It's wonderful to be here with so many incredible leaders in our community, and thank you to all the attendees. So I'm grateful to be here on behalf of Hindu Yuva. As a Hindu student organization with 33 chapters and counting across university campuses, Hindu Yuva aims to practice, preserve, promote, and protect Hindu Dharma, and of course, support and serve our fellow youth and communities of all backgrounds. So as we all know, COVID-19 severely impacted students in many ways, and they were left with instability and uncertainty in many aspects of their lives, and especially for international students without family to support them while they're here. So to respond to this, Hindu Yuva, along with Seva International, Bharatiyam, and Vivekananda House, quickly came together a few months ago to launch the Student Support Network. So within a matter of days, over 80 students and young professional volunteers mobilized to launch a student helpline. And the helpline covers all time zones and runs 15 hours a day, 7 days a week. And so through this support network, launched for youth and by youth, we've been able to support over 400 people personally through groceries, accommodation, medical and legal, resource direction, and of course, linking with the Indian Embassy for more specific support. We can go to the next slide. So beyond the immediate response to the helpline and immediate emergency response, we're really committed to providing ongoing support through various networks. So recently we launched a program that's focused on creating a mentoring network for professional development with over 200 individuals signed up so far. And the need for this moment is really linking students with internship or job opportunities, especially since many of them were quickly dropped a few months ago, leaving a lot of students without income as well as professional development opportunities as students and for their long-term career growth. So these mentors will be able to provide career guidance and skill set development. Another crucial need we identified was mental health, as we saw from the survey results as well early on, with an increased stress level, loss of social support networks, and through various webinars, our networks of mental health professionals and support groups were able to reach out to students and provide them with the emotional and mental health support that they may need. So sometimes we hear that youth or students may not be as motivated to serve their community or may have other priorities or are preoccupied with other things. But I think the Student Support Network was really yet again another wonderful example, proving this wrong and seeing how quickly that so many students could come together to support their peers. And so we're really grateful for the support and collaboration of hundreds of volunteers from Hindu Yuva, Seva International, Bharatiyam, and Vivekananda House in these efforts over the past few months and in the ongoing efforts. And we're really committed to continue supporting our fellow youth everywhere. Thank you.
Thank you so much, Amrita. I'm not interrupting you, right? You were done. Or is it an audio?
I'm finished up. Thanks.
There was a small glitch on my side, so I'm just making sure that I'm not interrupting you. So thank you again. And let's try and go back to Dr. Sampath Shivangi.
So thank you, Dr. Kandera and FIDDS for this innovating event. Congratulations. And since I'm on the National Board of Mental Health and State Board of Mental Health as the chair, I thought it would be a good idea to present some aspects of mental health that has affected not only Indian Americans, entire US population. So I'll spend a few minutes on what should we expect out of this pandemic? This is all about COVID corona, thanks to China. As per Washington Post recent editorial, it was in Wuhan, China lab since August 2018. I was not sure how many people have noticed that. Of course, it came out public in 2019, sometime September, October. But due to limited time, let me focus on the devastating effects of quarantine, loneliness, and social isolation that are twice as harmful to physical and mental health of all the population. There is a robust evidence that social isolation and loneliness significantly increase risk of premature mortality, the death, separation from loved ones, uncertainty over disease status, boredom can create dramatic effects. Suicide has been reported. Substantial anger generated because of isolation. 9 days of quarantine, just 9 days of quarantine would produce acute stress disorder, exhaustion, detachment from others, more avoidance behaviors, greater loss of income, showed substantial anger, annoyance, fear, frustration, guilt, helplessness, nervousness, sadness, and worry. It is observed that isolation and quarantine will lead to substance abuse. There is evidence that acute exposure of stress post-isolation would lead to addiction to drugs, alcohol, nicotine, cocaine, amphetamine, and marijuana. On the other hand, if quarantined or isolated people who use drugs may face dangerous withdrawal symptoms, reuse drug consumption of supplies, or illegal procurement of increasing the risk of overdose and death. This is not to suggest that quarantine should not be used. Not using quarantine and allowing disease to spread, mitigate to worse. However, depriving people of their liberty for the wider public good is often contentious, and lawsuits have been filed. Hence, needs to be handled very carefully. I hope I did not scare you, but made you aware of twists of life post-quarantine. Hopefully, world will emerge better in 2021 because we're expecting vaccination. Some companies are saying that they will have it the end of July, but I doubt it. But at least by December 2020, we're going to have vaccination. We'll have a new world. And thank you again for listening to me.
Thank you. Thank you so much, Dr. Sampath Shivangi. Apologies for all the audio issues we had earlier, but thanks for all the panelists for their insight and their thoughts and work they've been doing or their organization has been doing around COVID. Now the next session starts, which is our Q&A session. So feel free to ask questions in the chat that has been enabled now. For all the users and the audience and the guests who were not able to ask a question, the chat is now enabled. You can ask your questions. So we have few questions. I'll go over the first question. Rakhi Israni has this question for us. Rakhi, do you want to ask this question?
Sure. So this is actually for 3 different people. We'll just break it up. The first, from the medical's perspective, Dr. Shivangi, Dr. Reddy, if you can tell us, the shortage of beds that's being reported in the media about how it's getting worse in the summer. What is the ground reality? I mean, do you see that as far as like the hospital needs and all, is it increasing or is it getting better?
This is for me. Oh,
for Dr. Reddy or for Dr. Shangi, either one. Yeah.
Yeah. Can you repeat that question because I couldn't hear you, please?
Sure. So in the media, they're reporting that there's a lot of shortage of beds and the number of cases are increasing. From a medical perspective, I mean, what do you see as the ground reality? Is this?
No, I think it has improved tremendously last few days. And of course, there is an issue in Texas, Houston. And I'm just told, my daughter lives in Houston. She just called me and told me that they are going to use that stadium where Howdy Modi happened. That entire stadium is going to be converted into a mini hospital. So they are going to have 1,000 beds in Houston, Texas. I'm just giving an example. New York is self-sufficient, and majority of the states are, I don't see any issue except Texas. But I think they are on the top of it. And I won't anticipate any issues with the beds or hospitals in the US. Of course, in India, you're seeing in New Delhi, they have taken about 3 square mile area, and they're going to have 10,000 beds in New Delhi. And now they are ready with 2,000 beds to go. So I think all over the world, there's awareness, there is a preparedness. I think I need to salute Delhi government and Modi ji for doing extensive work on COVID.
Thank you. Thank you, Dr. Sampath Shivangi. So we have our next question. So just few housekeeping rules again. We'll go and take the questions for next 10 minutes, and then we'll proceed to our next section. If there are still questions which are not answered, please feel free to leave them in the chat. And if the time permits and if the panelists are ready to stay a little longer, we can address those questions. Second question is from Vipul Kumar to Mr. Chugh. There are close to 500,000 Indians on H1B, H4 stuck with COVID pandemic, followed by brutal executive order. How various groups trying to influence administration to help us? If not influencing the administration, how will we get help? Current efforts haven't yielded any fruits to these unfortunate people. How will these various Indian groups can help us? Mr. Chugh.
Yeah, thank you. Yes, the situation is quite unfortunate. Our current administration, reasons they know better, is quite anti-immigrant, and there's people inside the White House that are very anti-immigrant, even if generally the administration is not. And I think the first thing we learned about the current administration is the power of the executive orders. And so I don't think most of the country knew how much a president can do with executive orders. And some of us are actually surprised that the administration's not been even harder than they have been. We're trying, the American Immigration Lawyers Association, a nationwide body with 6,000 members, 6,000 immigration lawyers. We're very hard and tough with the administration and keep telling them of the hardships the H1 and L1 visa holders are facing. And 50% of the H1 quota of 85,000 is consumed by the Indians. So the Indians are more hurt than anyone else. It's really difficult. They're not even getting unemployment. And there's other Indian local organizations that are helping as well. Honestly, the biggest hope we all have is, very candidly, is that the administration changes in November. Otherwise, the immigration impact for Indians in this country will continue to get worse. But I suggest anytime you meet your congressperson, local senator, anytime you find out who they are, they're very approachable, and to drop them letters and call them and tell them that this nation was built by immigrants, and the immigrants to this day continue to give to the society and not take away, and to be decent and reasonable with the immigrants. Thank you.
Thank you. Thank you, Mr. Chugh. So next question is from Vaiju and Vijay. And this question is regarding flights. So I guess I'll direct it to Mr. Srinath. Seva International has been helping into that matter. So the question is, according to recent news, all flights going to Bharat are suspended till 15th July 2020. Are Vande Bharat flights still available? And in case of emergency, how to get on the list to visit Bharat if one's parents are ailing? Dr. Srinath?
Yeah, this is actually a question we constantly get. Our helplines are getting these questions, and this is best directed to the embassy. His Excellency is there, and they can answer that.
Unfortunately, he had to leave for some other
Okay.
work. So
Yeah,
this
has been, the flights are continuing. In fact, I know somebody who's leaving tomorrow, so it is not like it is stopped. But the challenge is that it has one way, which means that the flights are going from and US is now picking a bone that India is not allowing flights of US airlines. Some background noise. Okay. So there are a number of problems we have wherein a parent has passed away and they would really like to go to India, and especially if they do not have Indian citizenship, then this becomes doubly difficult to get them a spot. We have tried to get it intervened at the highest levels, the Embassy of India, the Consul General of India, and it is not very easy. And there are a number of such people with very, very difficult situations that are unable to go.
Thank you. Thank you, Mr. Srinathji. So next question is from Manisha. What is the impact of working from home in the long run? Maybe I'll direct this question to Mr. Vishal Khera. What do you think? What would be the impact of working from home in the long run?
Sure, thank you. So as an organization ourselves, we have about 200 odd associates in the organization. We have been 100% remote since March 14th or 15th. So it's been close to opening up again. But that is because we are in the IT industry. Our work is continuing as normal. In fact, we have seen productivity gains across all of our programs. So our communication to all of our employees has been that we are in no hurry to open up. As the DMV region, the District of Columbia, Maryland, Virginia region opens up and go into phase 3, we will still continue to monitor it. We are in no hurry to start having employees come in. Because one of the main reasons why we had the employees coming in was to enable them to collaborate across multiple teams and be able to have those face-to-face meetings. With all the best practices about putting the mask, having 6 feet of distance, those type of collaboration is not really conducive. You can rather do that level of collaboration on the Zoom and the Google calls. So we will be fairly slow in opening up our offices. We will wait and watch how things are shaping up. Now, when you say long term, I mean, in the next 3 to 6 months is not really long term when you are thinking in the lifespan of an organization or your career. So these things will continue as such for the next 3 to 6 months. We may have, we always have virtual happy hours. We started doing virtual games where we have people even do like decorate your office space and do some kind of awards, those kind of things. So we are in no hurry to move into back into our offices, and once things settle down, once life gets to normal, there is vaccine or other things, we might come back to offices.
No one knows how the new normal would look like.
Yeah, exactly. So visibility beyond 6 months, you really don't have much.
Agree. But thank you for that.
Sure.
So the next question is for Amruta. Impact on teenagers and younger kids, their mental health due to COVID shelter in place. Anything you would like to share on that? Amruta.
Sure. I think, I mean, there are both positive and potentially harmful effects, I think, of COVID and the shelter in place. I think one positive thing that we have seen is that families are spending more time together. I think many a times kids, or especially teenagers or young adults such as myself, who have lived far away and who have now come back home, are getting some family time and positive family time that they might not have gotten before. Although I think all of us are maybe in some capacity are experiencing, sometimes there's also an increased risk for family conflict. I think in more severe situations, there are also, there's a rise in substance use, there's a rise in domestic violence, and rise in possibly parental conflict. So these are all things that we should be mindful of. And also just keeping a check on our social media usage or how much we're accessing the news. I think especially with younger people utilizing social media even before this pandemic to really stay connected, but what are other positive ways that we can engage with our community and utilize social media in positive ways with responding to current events or staying connected with friends without it having so much of a negative impact or an overdose of the negative effects of sheltering in place.
Thank you. Thanks, Amrita. So next question is for Venk Shukla. Any impact of pandemic situations on startup fundings? Any thoughts on the current predicted fail rates for startups, especially Indian-owned startups? This is for Venk Shukla.
Yeah, thanks. I think in general, what has happened is that venture investing is a very one-on-one, very personal kind of, in the final analysis, a very emotional investment. So the fact that you cannot meet someone face to face has a very severe limitation on the pace of venture activity. Only, some of those activities are getting done where you had already met them before and you already knew who they were and you had looked into their eyes and developed a feeling of comfort. But otherwise, it's a very, the new deals you see have been very, very severely impacted. So, and I expect this thing to continue until places like Starbucks open so people can go out and sit outside and meet and have coffee. In some cases they have, but still the comfort level of people going out and meeting strangers is still not there. So I think that's will continue to have an impact. And another follow-on investing also is challenging now because none of the startups are meeting their revenue projections because in general, their customers are suffering. So I think this would have, I think until a vaccine comes out, until the psychology, mass psychology changes, this will continue to have a drag on it, though some of the deals will still keep getting done. Hope that answers the question.
Yes, thank you. Next question is for Kalpesh Joshi. How is the travel and hotel industry affected, and what are the survival plans till 2022, in 2020 and until 2022? This is for Kalpesh Joshi.
Thank you. As I mentioned earlier, we are working very hard to save whatever way we can, wherever we can get the help from. Right now, as you know, that our Indian owners are, many of them, they work at the hotel. So whatever way we can save, we are keeping our employees, but at the same time, wherever we can cut our cost, we are trying to do that. And hopefully, as I said, that we are keeping our place safe for our employee and our guest. So slowly business has started picking up. Some areas we are doing like now 20, 30, maybe 40% occupancy, which is like barely break-even point. That is what we are concentrating. And as Indian, we know how to handle the tough situation. So as I said, that if time comes, we will roll up our sleeves and make the beds for our guests, and we will continue to fight, and hopefully things get better soon. And then we are hoping that by 2021, our hotel industry will start come back slowly.